Today we've been hearing more about the transformation programme that exists across the whole of the North East in Cumbria. This is supported by Next, but is actually led by all of the CCGs within the region, and one of the aims of setting up that programme was to really think about the opportunities of doing things at scale but supporting local delivery. So what we're doing is trialling and testing things in one area and then looking to quite quickly roll out to adopt and share and spread across those other areas, really seeking to maximise our own internal resources to gain efficiencies and really support an improvement of patient outcomes. Some of the things that we're focusing on at the moment, we've got a number of programme boards, and those are looking at things around back pain, learning disabilities, urgent care, digital health, continuing healthcare. Those are just a few. But out of today's event particularly, we want to think about where should we go next? What are the things that we should look at? What are some of the things that would really benefit from doing a real large-scale piece of work? And we've been talking to CCGs across the region to get their ideas, and we'll be thinking about that and feeding that back into the Transformation Board. So what are some of the things that we've been talking about today? Well, we started off hearing for some real life case studies from a whole range of CCGs and their partner agencies. They were telling us about some of the things that they've been doing to change pathways, to change services, to maximise efficiencies and financial savings, but also bring about real improvements in outcomes for patients. We then heard about the Next Knowledge Hub, which is an information portal which is all aimed around sharing best practice and learning, and has a whole set of case studies and information that people can access to help them in their transformation work. We also heard about the National Commissioning for Value Packs and how these can be applied, are being applied and can be applied across the region. And also we heard about the STAR tool, which is a process that enables CCGs to take a cost-benefit approach to prioritising commissioning decisions. Finally, we had an update on the North Eastern Cumbria large-scale transformation programme, and then we moved into some group discussions where we're asking people to think differently about QUIP. What is it that we need to do in the next 30 days, 60 days, 90 days, and looking forward into the next financial year? How do we need to think differently about QUIP, and how can we support each other and share that learning across the region to benefit both the patients and the populations that we serve?
It's been a good opportunity today to begin to discuss some of the key issues around digital health and self-management. It's been good to talk to colleagues about how we can actually now get information from phone, text, app and into the internet systems to begin to move it through into the patient record. This will open up a new way for self-management. So it's been good to discuss that and understand what else people are doing around this. One of the key issues for us now is to actually empower patients to make it work, and that's where some of the true QUIP will come from in terms of the organisations and what they need to do. It's the next big breakthrough in my view in terms of what goes on.
And I was here today presenting about a piece of work I've been doing on the STAR project. STAR stands for Socio-Technical Allocation of Resources, and what it does is it takes health economics and economic analysis and tries to apply that into a much more sort of easy format to use to help CCGs and commissioners make decisions about prioritisation. It also pulls in sort of clinical viewpoints and consensus and service user opinions. What we do is we bring together and we run decision conferences where we bring everyone together and we work through these processes, and what we do is we get an output of recommended areas for efficiency, how and where we can make further savings or improved investment.
Commissioning for Value is a national programme out of NHS RightCare. And at Next we're trying to take this information and make a lot more sense of it for our CCGs. So it's not just about the cost, it's not just about the outcomes. We're trying to triangulate all of these things together to make more sense of it for our CCGs. So it's all about benchmarking so that CCGs understand where they are, and also trying to very deeply within each pathway to understand what services are being delivered and how best to attend to them.
I'm here today attending the QUIP workshop to talk about the Knowledge Hub website. This is an initiative which Next has developed. It's a best practice sharing website. We capture examples of basically any healthcare initiatives that are taking place, We're particularly interested in capturing examples of QIP efficiencies, any improvements in clinical pathways, any examples of clinical improvement at all really. We're just gathering information to put on the website currently. The website has a number of elements to it. We capture case studies, which is the main focus. Case studies have a brief abstract of what an initiative is. They capture information regarding how easy it was to implement or how complex, any investment costs, that kind of thing, and also evaluations of what users can log onto the website and see if something worked well or didn't. And even if something didn't work well, the lessons learned from that can be quite powerful. We also have an online forum on the website where users can link with like-minded colleagues to pose questions, help with any difficult situations currently, and it's just a protected community of healthcare workers really. We also have a section for anonymised service specifications to reduce duplication of effort across the region, and we also have a resource section for any useful links, any documents relating to transformational change, QIP initiatives, that kind of thing. We also have, we're working in collaboration with the Ellis group of CSUs, which is all of the CSUs from across the UK who have come together to work collaboratively on the project, and we are also gathering information from them to put on the Knowledge Hub website, so it will mean that users will be able to access information that relates not just to the North East of England but across the whole of the country.
Well, the purpose of the day, well, for quite a while I'd had a thought that actually we're not that good at sharing some of the things that we're doing around QIP programs, and it seemed to me that we needed a spark to actually make that happen. So I came up with the idea of literally having a workshop, and I started exploring that with a few people, some of the chief finance officers and with Next, and it quickly gathered traction. And with the support I got from Next, it was absolutely fabulous. We actually found people to actually make this thing happen. So I have had today about 13 speakers who have told us individual QIP plans, what they've been doing, what they've achieved. Not everyone's been totally successful, but actually just learning from that and sharing with that. And today I think an awful lot of people made connections about who to speak to in the future. It's certainly definitely sparked also about how can we do this better from a regional level, how can we influence the regional schemes we're going to do, and how can we work together to make sure if somebody's got a really good scheme, we share that knowledge and share that scheme really widely. So that was the aim of the day, and I like to think that it's been reasonably successful.